I first came into contact with CAMHS when I was about 15, 16. I lost quite a lot of weight quite quickly. My parents took me to see our doctor, our GP, who diagnosed me with an eating disorder, with anorexia. And I was in a really dark place. I felt really alone and felt like nobody really understood what was going on, and actually I didn't really understand what was happening. So I was admitted to a CAMHS inpatient unit in Oxford. From the first day that I arrived on the ward, everything felt really unfamiliar, very scary. Because I'd been taken out of school and away from my family, I felt really lonely, and actually everything felt really overwhelming. I remember feeling really scared. Very quickly after I arrived on the ward, I was welcomed and supported by all of the staff there, from the healthcare assistants, the nurses, occupational therapists, doctors and psychologists. Everybody was so welcoming and reassuring. And I really quickly realised that I would be okay, that I was in the right hands, and I was going to have some fantastic support there. I physically recovered, so I regained the weight that I needed to. And by Easter, the year after, I was discharged from hospital. I carried on having support in the community from CAMHS, and I had some fantastic therapy as an outpatient. And then I was successfully discharged from CAMHS shortly after I came out of hospital. When I went back to school, I remember feeling really amazed by the support that I'd had from some fantastic psychologists in CAMHS. And I really wanted to understand how it was that they supported me and understood me so well. So I decided to take psychology A-level. And I learned more and more about psychological models and research and different settings where psychologists work and how they support people. From there, I went on to study psychology at university, and I worked in a mental health service near my university while I was studying. It was while I was studying and working in a mental health service that I realised that actually this was the only thing that I wanted to do. And so I took the decision to move down to London and started a master's in mental health sciences. And I now work as an assistant psychologist in an adult mental health team, supporting people in crisis. And I support them at home so that they don't have to go into hospital. When I'm working with people who are in really dark places, I always carry with me the hope and the compassion that I was shown by all of the staff when I was under CAMHS. And I wouldn't be able to do what I do now without the inspiration that I was given from CAMHS.